Good morning, everyone. Welcome to Caffeinate and Innovate, where we chat with leading experts in prevention science. These 30-minute sessions are designed to wake up your creativity and help you think outside the box. If you have any questions while we're going today, feel free to drop those in the Q&A at any time during the session. And if you'd rather ask your question out loud, we are going to have some time at the end where you can unmute and jump into the conversation. If we don't get to every question today, I will send a follow-up with Ashley's responses after today's session. I am thrilled to welcome our guest today, Dr. Ashley Scudder. Dr. Scudder is a clinical psychologist and prevention scientist with the Partnerships in Prevention Science Institute at Iowa State University. Her work centers on strengthening early parent-child relationships as a foundation for lifelong mental and behavioral health. She leads several large-scale initiatives to implement and adapt parent-child interaction therapy, or PCIT, for families in under-resourced and rural communities. What's especially exciting about her work is the way it bridges prevention science and real-world application. She focuses on early intervention to prevent long-term challenges like child maltreatment and intergenerational cycles of substance misuse. Ashley's leadership is helping to bring evidence-based tools into the hands of community providers, right where they're needed most. We're so lucky to have her with us today. Welcome, Ashley. It's wonderful to have you here.
Well, thank you for having me. And I think just what a fun and creative idea to have Caffeinate and Innovate, where we get to start the morning together, get to have a little coffee to get the day going. So I truly appreciate getting to be here with everyone.
Absolutely. Okay, well, I'm going to get started with just a general overview. Can you tell us what the PCIT Early Childhood Initiative is?
Yeah, sure. Our early childhood initiative is really it's a prevention focused effort where we're working to bring evidence-based parenting interventions to underserved communities. We center largely in Iowa, but also across the US and other states. And it's been focused largely in its start with parent-child interaction therapy, or some people might know it in the community as PCIT. And it, this is an intervention that's really a powerful skills-based intervention for caregivers of kids that have challenging behaviors that are age 10 and below.
Awesome. Um, can you tell me why Parent-Child Interaction Therapy Early Childhood Initiative is part of the Partnerships in Prevention Science Institute, what they offer as part of prevention science?
Yeah, absolutely. I think part of what makes the work that we're doing innovative is really that we're working to scale beyond the traditional clinic into communities. And I think this has been something, historically that has been a focus and vision for the Partnership for Prevention Science Institute. And so within PPSI, it has also focused as an institute on bringing proven prevention and intervention programming into real world settings. And PCIT in the early childhood space is really one of the most rigorously studied evidence-based programs that's out there for young kids. So we sort of see it as a cornerstone for our prevention work, that it's a robust model and it's really foundational for communities. And if we can help caregivers build their skills early, then we think about the long-term changes and outcomes for not only children and families, but communities as a whole.
Yeah, and speaking of those long-term outcomes, what is the PCIT goal for the parent and child?
The real goal is enhancing quality relationships in young children's lives. With that, we see a reduction in challenging behaviors of kids that are moving through the PCIT program. We try to focus in on helping parents strengthen things like their positive attention skills, building structure and consistency and limits in their caregiving, learning how to calmly, manage challenging behaviors in young kids. And then over time, it's not only the behavior, that improves or the relationship that improves, but you'll see improvements in emotion regulation, attachment, communication. And with PCIT, these changes happen relatively fast if we think about the scope of it. So sometimes I'll talk with parents about, this is really something that has come up for your family in the last 4 years when they have a 4-year-old, or 7 years when they have a 7-year-old. But the changes we see in PCIT are really within the first 4 weeks. We would say families are certainly feeling a difference. And so, big picture, it's a brief intervention where families see big changes pretty quickly.
That's awesome. We're going to stop for just a little bit and show a video that kind of shows how PCIT works so everyone can get a better understanding of what PCIT is and what goals it does meet.
So I'll just say a little bit as you're getting the video cued, so that those that are here kind of paying attention to the things that you'll be seeing. The video that's going to be showed, you're going to see some of PCIT in action towards the end of the video. It'll focus in on child-directed skills. So we talk about the pride skills. There are things like praise, reflecting the child, imitating, describing, building enjoyment. And you'll see that. The other thing you'll see in the video is some coaching that's happening. So this is in the moment live coaching. The therapist may say things like, go ahead and say, I love the way you're stacking that, or give him a pat on the back. And that really is the delivery format, that it's right there in the moment. And they have a therapist who is supporting them along the way in their parenting interactions. So maybe we'll show the video and then we can check in to see what people notice about the skills.
When 2-year-old Richard looks into his mama's eyes, he knows the true meaning of tender, loving care. His older brother Doyle hasn't always been so sure.
He was so afraid. He was in a corner, shaking, back then, scared. He would run to a stranger before he would run to me.
An 18-year-old single mother with limited parenting skills, Tammy Victor was raising her children in the same abusive way she had been raised.
I slapped my son. I threw him at a wall. I kicked him, punched him, slapped him. All those scream, holler, cursed at him, threw him around. All those mean things to that boy.
Ultimately, Tammy herself called the police and asked for help. What she got was 6 months in jail for child abuse. Richard and Doyle were put into foster care until the courts were satisfied they would be safe with their mother.
So I went to go visit my kids, and they was just sitting there looking at me, laughing. Hi, Mama, I love you, like that. I'm like, okay, why do they love me? How can they love their mom? After all I put them through, how could I get love back from them?
If you're 4 years old, regardless of what your mom or dad does to you, you still love them, you still need them. You don't just need them as a figure, you need them every single day in your life.
Anthony Urquiza is a psychologist at the UC Davis Medical Center. He oversees a new program there aimed at helping abusive parents find new ways to discipline. Like Tammy, most of his clients are sent to him through the courts. It's a last-ditch effort to get their kids back.
We had to change the relationship, and we had to fundamentally change some of the things that parents do with their child to make them be better parents.
Mommy has something to tell you guys, okay? Now, this is special playtime, okay? And special playtime, we play nice with all the toys.
This one-on-one therapy session uses a traditional parenting model called PCIT, Parent-Child Interaction Therapy. Urquiza hopes the basic parenting principles of PCIT will teach Tammy a better way to get her kids to behave.
You need to praise your child for the things that they do or that are appropriate. You need to describe appropriate behavior, give them a lot of attention for what they're doing that's okay and appropriate, and as soon as they do something that's not appropriate, then to ignore that behavior.
You might want to go into an ignore and start playing with Doyle, and and God should love to play with Richard if he were sitting nice at his seat.
Yeah, if Richard was sitting nice in the seat, he could play with us.
Through an earpiece, Tammy is being coached by a therapist to praise good behavior and ignore the bad. Not an easy thing to do when Richard is in the midst of a temper tantrum. It's this kind of situation that used to result in abuse.
If he would come up with us and play,
We could
have so much fun.
great ignoring, Tammy. Really good
So
ignoring.
much fun with us, but that's okay.
It's great because you are in control right now.
The research bears it out. By breaking down old abusive patterns, Tammy is helping her children build self-esteem. And as an inherent bonus, she is becoming a better parent.
You have to give them some skills, but you also have to change the quality of the relationship so that it is self-sufficient in generating a lot of the empathy, a lot of the positive attention. That's what we have to change so that parents, even when they're at their most frustrated, are still not going to hit their child.
Okay, Tammy, why don't you turn to Richard and pat him on the back and kind of rub his back and say, I like it when you're quiet.
Yeah, I know.
Oh, Richard, I like it when you quiet.
I'd really like for you to come back and play at the
I
table.
really like for you to come back and do special playtime with us.
Here's where Tammy must apply her new skills. Richard's temper tantrum has lasted a very trying 15 minutes. Can she get her son to cooperate without being physically abusive?
Would you come sit at the table for me? Oh, thank
Good
you
job,
so
Fred.
much.
Crazy.
Great job. Yes.
Now
Oh.
pull his
So I think she
chair.
has a really good chance to be safe with her kids in the future, to work with her kids so that they can be good, healthy kids, feel good about themselves, feel good about their mom. She's not out of the woods yet, but she's got a really good chance.
You like this one? Okay.
Quite often, children placed in foster care are not reunited with their parents. But Tammy has proven people can change when something as precious as a child is at stake.
Good job. Doyle see me change, right? Doyle can grow up and say, okay, well, my mommy changed. Doyle knows now. You know, he has an idea that people can be different. Give me a hug. Oh, thank you.
Learning to be a better parent is an ongoing, lifetime lesson. And the court system believes Tammy has learned hers. Today, she has full custody of her sons. And Richard and Doyle have a mother who makes them feel loved and valued and safe.
Happiness, a lot of happiness, a lot of fun times, a lot of saying to myself and to my kids, you know what, we made it. Mommy made it. Great job.
So I'm curious if there are any reactions from the video. I'd love for folks to put it in the chat if there's anything that you're thinking as you watch that. PCIT is an evidence-based program for disruptive behaviors in early childhood. It's also evidence-based for families that have experienced child physical abuse. So we do work a lot with child welfare populations and parents that are coming in with high-risk parenting practices and parent stress.
Yeah, so I'm just going to continue on. If we get any comments, we can stop and chat about those too. But what makes this early childhood work different than what others are doing in prevention science?
I think this work, you know, what's most interesting to me is that the approach is really focused in on taking gold standard, so the most robust interventions in early childhood space and moving it into rural communities in particular, but that are largely having limited resources. So instead of trying to you know, push a gold standard in without that prevention science perspective, we're really focusing in on how do we make the intervention fit the local workforce and the local communities that it is fitting within.
To fit this into what everyone here is looking to gain, what are some strategies that prevention specialists can use or suggest to parents and caregivers?
So I love this question. So I think if we think about the first set of skills that are learned in this program, they're really skills that I would love to see sprinkled everywhere. PCIT is a model of over practicing. So what you'll see is that families will use these skills in special time, which is 5 minutes of over practicing the strategies as adults to get really good at them each day. And then they begin to become, part of their relationship and the way that they're engaging with the child over time. So just to give a few quick skills, we think about the pride skills and child-directed interaction. So the first is praise. And we really work with caregivers to understand the concept of labeled praises, which are really specific praises about the child's behavior or what the child's activities or products when they engage together. The second skill is maybe less known. As families are getting started, they're called reflections, which is a mirroring back. So therapists use it often with adults and kids in therapy, where they mirror back what someone has said as a confirmation of what they've said. So that would be the child says, "I'm driving the choo-choo," and the parent says, "Oh, you're driving the train." So they feel heard, and it slows the parent down to really pay attention to the child during their play. The third skill is imitation, where we'll actually have the caregiver focus in on the step-by-step of the child's play and imitate what it is that they see. So if the child's drawing a picture, the caregiver is going to get a piece of paper and draw a picture as well. Again, keeping the child's positive behavior in the lead. We always say imitation's the greatest form of flattery. So kids that are in this age range, they love to be imitated. They love to see that their caregiver is doing and playing the way that they do. Then we also teach description, which is a narration. So I often say it's like being a sports announcer, where you're giving the play-by-play of what a child's doing. So the child is building with blocks, and the caregiver learns to say, "Oh, you put the red block on top of the blue, and you're making it really tall. You're going to put the guy on top." And so they're not interpreting anything. They're not always relying on positive reinforcement of praise. They're using this sort of matter-of-fact observer strategy as well. Descriptions we actually see out of all of the skills keep kids on task more. So they're really, used and taught to caregivers who are coming in talking about children's attention span and focus and things like that. And then maybe the last skill just to give today would be enjoyment. And so we'll work with caregivers on how to really match children's enjoyment. So taking their body signals and, the child's own enjoyment and reflecting that back as well. We are working with highly stressed families, and it can feel a little frivolous to sit down and do something as seemingly simple as play. And so we have to give permission, to adults to set aside all the things they're doing in their day to day and really just take 5 minutes to be right there in the moment with the young child. And so enjoyment is actually something that with caregivers we work on, we give them permission to really just unlock their inner 4-year-old or 5-year-old and use their child's signals as a way that they can, kind of pay attention to how they're enjoying the play too.
Thank you, Ashley.
Yeah.
I do have one more question before I open it up to our participants. So what are some examples of behaviors that have been changed through PCIT? Can you give an example of a case where PCIT changed a child's behavior or a parent's behavior?
Oh, absolutely. I think for context, it's important to understand that there's no behavior that's too bad or too challenging within this age range. So PCIT was initially developed for children with early onset conduct problems. And so it is built to tolerate the most difficult behaviors. And I would say parent and child behaviors um, that that really it has big impacts for families that are coming in with high needs. Because of that, over time, this is something that was developed in the 70s, so it's not a new intervention, but I think its movement into communities has followed similarly to other evidence-based practices that now there really is a push of scale up and having them available to families where they're accessing supports. Um, it's been adapted for many children and families. So, selective mutism, self injurious behavior, anxiety, separation anxiety, OCD. Children on the autism spectrum now receive PCIT services. So, I know that's not quite your original question, Tess, but I hope that gives maybe a bigger picture of the behaviors that could be impacted. Yeah, so anything that falls under challenging for parents or teachers or peers in this age range, I would say, would be in the scope of PCIT support.
That's awesome. Thank you so much, Ashley. I
Yeah.
know we already have some questions in the chat, and I'm sure we have more questions for you as well. So I want to make sure we leave some time for everyone who's participating to join in the conversation. We will start with anyone who wants to chime in by unmuting. If there's something on your mind, go ahead and just join the conversation. We would love to hear your thoughts and keep the chat going.
I see the question about, are there any data about using the ignore the less ideal behavior technique with children and families without those risk factors? So I will say, I think that there's more, there's more to say and explain. It's the nature of this kind of quick presentation. But what we help caregivers work on is not only using selective attention, but using redirection as well. And these are not things that are part of typical parenting. So, typical parenting, the data demonstrates time and time again that challenging behaviors and pro social positive behaviors, parents react to them similarly, if not more to challenging behaviors than others. So I think context, PCIT is a program for families that are coming in saying that the strategies they're using are not effective for managing the behaviors that they're seeing in their child. But so the short answer is if a family did not have behaviors to not give attention to, then the coach would not work with the family on that. I think that's maybe what Emily's wondering about. But for those of us who've been around small children, there's lots of things that we choose second by second, moment by moment to either give attention to or not, whether it's whining, a tantrum, stealing a toy from a sibling. That's part of parenting in this age range, is like the moment to moment analysis of how to respond to those behaviors to nurture and help grow that relationship and skills that child needs as they develop. So, what PCIT teaches that typical parents don't do is the idea of redirection. And we actually know that you need much less non attention if you're using redirection. So, if there's a minor misbehavior, the caregiver will actually play on their own, describe their own play, and then they look immediately for a positive opposite behavior. So let's say that there's a habit of whining every time they don't get something that they want, and the pouting behavior is something that they're working to support the child on. the caregiver will move over to play. And as soon as that whine goes down, they'll go back over and they'll say, "Oh, I love how you calmed your body there." Or the caregiver might give a little rub on their back if they need some support in calming the body, but they just kind of keep it neutral, because what happens in typical parenting is that that's magnified. And so it's actually a very easy way to help support parents in making some of those decisions on behaviors that have been challenging over time. Okay, thanks, Emily. Okay, has the rise in smartphones and screens changed how PCIT works? Are some parts more or less effective? I think the rise in smartphones intersects with PCIT in two ways. Families are much more stretched with technology pulling their attention, I think, as caregivers. So there's actually an adaptation now to help parents learn how to reduce screen time for kids who have really explosive behaviors when they lose technology. So that's real, I think, for young families that we're working with. It's now in the diagnostic manual that tech problems are in young kids is a real issue that we see in society. I think of PCIT as the original socially distanced intervention. So, the therapist is wearing a bug in their ear microphone headset, and the parent and child are engaging together in a typical therapy room. And so PCIT was doing that much before even COVID hit. PCIT was using technology. Telehealth is shown to be just as effective with PCIT for most families as coming into a clinic physically. So I don't think those pieces were, I guess that shift in our society, I don't think it impacted PCIT as much as it maybe did some of the other interventions. And then as far as less or some parts more or less effective, I would say what I see most is that, it's family specific. So thinking about the context of the family and what's going to set them up for success with their learning is what I would think about most in making that choice.
Thank you, Ashley. I'm going to pause for just a second. I just want to thank everybody for their attendance. We've got one more minute left for their attendance and participation today. I know there are a couple of questions that did not get addressed. We will absolutely send a follow-up to everyone who's here today. I'll talk with Ashley a little further, get some answers for those and send them out to everyone. We do have one last slide here with some links and QR codes for you to join our next Caffeinate and Innovate session on July 16th, where we're going to welcome Jason Kilmer, same time, 9 to 9:30. We do it every third Wednesday of the month. And then we also have some PCIT resources. The QR code will take you to the PPSI website. There's this resource kit that Ashley has put together for us. And then you can also drop your email in the chat if you'd like Ashley and her team to follow up with you after today, just to kind of get that conversation, continue the conversation from today, because I know these are very limited. We just have very limited time here. Megan's also put those links in the chat, and then we have our survey for today. So thank you, everybody. We really appreciate your time and participation.
Thanks, Tess.
Thank you, Ashley. Yes, thank you so much.